Stacy Bido, and I'll be performing for IV certification the CBC dressing change. Dallas, if you could just scan the room. Perfect. Okay, so the first thing I've done is I have checked my doctor's orders and I see that I need to do a dressing change on my patient. So I am going to gather all my supplies. I'm coming into my patient's room. I've performed hand hygiene, and now I am going to make sure I have the right patient. So, hello, can you give me your name and date of birth?
Nicholas Shea. I was born November 3rd, 1998.
Great, so I have the right patient. And now I'm going to tell him what I'm going to do. I'm doing a CBC. I'm changing your dressing, and so I can explain to him. And the first thing I'm going to do is I am going to look at the site, and yep, the date is 10/28. It's time for me to change the dressing. So perfect. So I'm going to prepare my sterile supplies. This might take a while, but. I'm going to try and maintain sterility. So I have all my supplies. I'm going to don a mask as per the Okay, now I'm going to move this down because I want you to hear me, but I have my mask on, and I'm going to have my patient sort of face away from the site. Now I'm going to palpate around the site first just to see, is there any tenderness, is there any redness. Everything looks great, so I'm going to don a pair of gloves, clean gloves, which I don't have, but I've got clean gloves on now, and I'm going to pull the dressing and they're clean. Sorry if this hurts. And again, I have gloves on. I probably would have pulled this Tegaderm without the gloves, but okay. So now I haven't touched the site. I'm going to look and I'm going to note if there's any drainage, because I'm going to document it if there is. I'm going to document the type, the odor, the color, and the amount. I'm also going to note if there's any drainage around the site, and there isn't. It looks fantastic, so that's good. I'm going to put it in the garbage. And again, I'm going to make sure that I've never turned my back on my actual sterile field or my patient. So now I'm washed my hands again, and I'm going to put my gloves on. sure I don't touch my hands. I keep everything sterile. And I'm good. And I want to make sure that I keep my hands above my waist. Now, first thing I'm going to do is I'm going to grab the chloroform. And I'm going to activate it. And I am going to clean the site in a square. So I'm going to start with and chloroform is activated by friction. So here, I'm going to clean here, I'm going to clean here, and then I'm going to contaminate my pinky and I'm going to lift it, and I'm going to clean here, and it's good and clean. Okay, and then I'm going to take the 2x2, I'm going to place it on the site. I'm going to take my Tegaderm. And I'm going to place it on the site. How are you doing, Mr. Shea?
Good.
Okay. And it looks good. And then I'm going to, now I'm done with the sterile part. And I am going to write down the date, the time, and my initials of the dressing change. And I'm going to, I could take my gloves off, but put them on as well. And now I'm going to go out. I'm going to document all the things that I've encountered, the dressing, whether there was any drainage, and if there was, taco, the type, the amount, the color, the odor. I'm going to document how the patient tolerated the dressing change, and clean up my supplies, raise the bed up, wash my hands, and make sure that the call light is in place for the patient, and ask them if there's anything I can I get you anything for you?
No, I'm fine.
Perfect. And that is how you do a CVC dressing change.